Mental illnesses are any disorder that affect the mind, including cognition, mood, and behavior. Mental illnesses are often misunderstood, leading to a stigma around those with a mental disorder. Common misconceptions are that people with a mental disorder are crazy or destructive, but the truth is that mental disorders are very common and a few can actually be treated. Here are some examples of common mental disorders.
ADHD is attention deficit hyperactivity disorder. It's something I have. It's you get distracted really easily, and most people are incorrectly diagnosed with it because you can be at home and get distracted, or you could be at school and get distracted. But everyone is always at some point they just look off in a different direction and they just kind of go into their own little world. But that's not just the only thing. ADHD usually has to be diagnosed before the age of 12, and it has to be shown in two different scenarios, like school and home, or maybe at a sports practice and at your grandparents. Like, it's just got to be shown that you're constantly getting distracted and you're constantly not able to focus on anything before they want to put you on meds. Because recently, lots of people say they have ADHD, and then lots of people get prescribed incorrectly.
Depression is a mood disorder that creates distressing symptoms that changes the way a person functions. The signs and symptoms are sadness, empty mood, pessimism, feeling helpless, loss of interest in activities, low energy levels, appetite loss, and thoughts of suicide or suicide attempts. In this figure shown, 3.1 million adolescents aged 12 to 17 had a minimum of one depressive episode. As you can see here, our teenagers aged 16 to 17 have the highest rates of a depressive episode with 17.4% and 17% respectively. The current treatment involves going to a health professional only taking medication, or going to a health professional and taking medication. Lastly, the effects of depression are low self-esteem, substance abuse, isolation from others, and suicide. Anxiety is a very common mental illness that affects many high school students. There are numerous different anxiety disorders, but anxiety is generally defined as causing enormous amounts of stress and worry. The signs and symptoms of anxiety includes constantly feeling nervous, sweating, trembling, rapid breathing, and worrying constantly. High schoolers are a population that commonly have high rates of anxiety disorders. Studies have found that around 32% of students from ages 13 to 18 have anxiety disorders, with ages 16 to 17 having the highest percentages. The current treatment for teens includes seeing a psychiatrist, psychologist, or clinical social worker. The effects of anxiety on teens involves dropping out of school, substance use and abuse, alcoholism, and anxiety disorders that follow them into adulthood.
Bipolar disorder is a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Over 6 million people are affected by this disease, and over half of those age range from 15 to 25. There is no current cure for the bipolar disorder, but it is often accompanied by other illnesses. The depressive lows include lack of interest in things you used to love, loss of energy, difficulty sleeping, changes in appetite, difficulty concentrating, making decisions, and remembering things, as well as suicidal thoughts. The manic highs often include feelings of abnormal excitement, talking very rapidly or excessively, needing less sleep but requiring plenty of energy, and feeling irritated, hyper, or easily distracted.
Eating disorders are psychological disorders characterized by unusual eating habits. Some disorders, like anorexia, result from a severe deficit in calories, while others, such as bulimia, result from overindulging. Some result from both binging and purging, such as binge eating disorder.
Abuse of substances is when you use alcohol, prescription medicine, and/or illegal drugs in a non-controlled way. Substance abuse differs from addiction. If you use illegal drugs, it is easier, or if you use these substances, it is easier to quit them. But if you have an addiction, it will harm your body if you quit them. Some commonly abused drugs are alcohol, marijuana, nicotine, Adderall, prescription opioids, hallucinogens, inhalants, Xanax, etc. Depression, anxiety, and all those mental illnesses we have, teenagers mostly have, can lead to consuming these substances. For our intervention, we propose an experiment involving 100 high school students, ages ranging from the 16 to 17, and these students will participate in a specialized school program, similar to the conditions of the first semester of junior year of high school. We plan to split our group of 100 students into two groups, Group A and Group B. Group A will attend classes like normal school, but these students will be required to attend bi-weekly health evaluations with a guidance counselor. Group B will be attending the same classes as Group A, but these students will not have the mandatory bi-weekly checkups.
After we've completed our experiment during our 8-week time period, we will look at the grades, the behavioral studies, and the overall well-being of all 100 students to discover whether the bi-weekly mental health checkups with our guidance counselor did indeed help the students with managing the stress and struggles of teenage high school life. We hope to display to all students of all ages that talking to somebody about your stress and your struggles truly does help.